Hi, everybody. It's Susan Thornton with the Cutaneous Lymphoma Foundation, and welcome to our August edition of Facebook Live. And tonight we have with us Erin Kopp, who is an acute care nurse practitioner at the City of Hope, and she works with and on the cutaneous lymphoma clinical team. So Erin joins us from the lovely city of Los Angeles, or the greater Los Angeles area, I should say. Welcome, Erin.
Thank you, Susan. Hi, everybody. Thank you for having me here.
It's great to have you. And for some of you who may have joined us at our two-day program I'm trying to remember, that might have been in LA, where Erin spoke about self-care and mindfulness and some of the things that we don't often talk about, but I think are really important when you deal with a disease like cutaneous lymphoma, which can be long-term and chronic and sometimes challenging to deal with. Finding ways of coping with that are easy, that you can incorporate into your everyday life, that'll help you manage the stress, maybe not only the stress with the disease itself, but sometimes just the stress of life. I think we all can use a little help in that arena. And so tonight I'm going to turn it over to Erin, and she has a particular interest and expertise in this whole topic and arena, and she's going to share with us her thoughts and ideas on how we can all take better care of ourselves and maybe reduce our stress a little bit, even if we happen to be living with cutaneous lymphoma. So Erin, take it away. And then if you want to ask questions, feel free. We'll either answer them as we go along, or you can save them to the end. Whichever works best for you, we'll do our best to make sure everybody gets their questions answered. So, alrighty, we're off and running.
Thank you again. As Susan was mentioning, I do have a particular interest in mindfulness and self-care. Traditionally, in chronic illness, there's many challenges that occur over and over and over again. And illness doesn't stop because our lives have something else going on, right? The itching doesn't stop because your friend is having a bad day. The ulcers don't heal because you're having a challenge at your workplace. And all of the relationships that you have with yourself and with the caregivers around you and the people that you interact with on a daily basis are intimately involved in some way or another in how chronic illness affects each and every one of us every day. So that's where my interest comes from. I do, when talking to patients that I see on a daily basis, share with them that I think when you're approaching cutaneous lymphoma, that you really have to think about it as a chronic illness in many situations. I think Susan can agree, even in the most recent newsletter talking about the journey. It is a journey. There's not a definitive end to many of the illnesses that you're facing, many of the symptoms, doctor's appointments over and over. So if you can think that you can have some techniques to deal with the day-to-day, sometimes it makes things a lot easier to deal with, and it also helps in the overall outcomes. So I'm hoping we can all get something from learning about mindfulness. The reason I choose mindfulness is because it's simple. Simple to learn, difficult to master, much like anything that's important. And mindfulness is really just being present and being aware. If you think about it, you may say, oh, I'm present, I'm paying attention to what's going on. But when stopping and taking a look at things from a distance, it's easy to see that we're not always present in the moment. And a lot of times, especially with chronic illness, our symptoms take over what we're feeling, what we're doing, how we have, what perspective we have on life. So the benefits of mindfulness practice, and not just my opinion, but there's been study after study in multiple different populations, people who are in the intensive care unit to people with solid tumor cancer. Not as much in this group, but we can change that. But there's proof that mindfulness helps the immune system, that reducing stress leads to better results in the treatments that you're seeking right now, and also just peace And I think that's one thing that's hard to find when you're facing a myriad of symptoms on a regular basis. So I asked the question, how could mindfulness influence the self-care habits in the setting of chronic illness? We all have a default mode, I think so. I think as we go through life, we see things so often that we go into autopilot, right? Mindlessness is what they call it. And it's our tendency to not be focused and be in a reactive mode. So use the example of driving on the freeway. I live in Los Angeles, I drive a lot. So if I was totally focused all of the time, the level of stress might be high. And I've done this drive from my home to City of Hope, for example, so many different occasions that I don't need to think about it necessarily. So I'm in autopilot unless somebody cuts me off, and then I'm in reactive mode. So instead of being proactive, preparing, thinking, being more in control of what's going on, I let things happen to me. And that's default mode for many of us in the majority of our lives. So we walk around and we're thinking about things because it's the default mode of the mind. But what are you thinking about? Right now, are you thinking about exactly what we're talking about? Or are you thinking about that plus in an hour you have to go and fix dinner if you're on the West Coast? Hopefully in an hour if you're on the East Coast, you're thinking more about going to bed. But little things slip into our mind, and on default mode, we don't really have any influence over that. So we're not present, we're not here now. And in the face of chronic illness, especially with CTCL, there are so many symptoms. Like I said, the itching, the pain, oozing, discomfort, if there are tumors, dressings, all of these things can take over in default mode. And if we try not to pay attention to those, we actually do more of a disservice than we realize. So, we talk about it. Automaticity and reactivity go hand in hand. If I'm on autopilot, then generally the way that I'm going to respond is reactive. And if I'm reactive, I really don't have any influence over how I'm going to feel. So where does the mind go and who's in charge? Now, I'm not suggesting you have to be in control of your thoughts all of the time, but we have seen that mind wandering is really an excellent predictor of people's happiness. And some people think, oh, wandering mind is great. I'm going to daydream. I'm going to be happier because I'm not caught in the midst of whatever turmoil is going on, whether internally or externally. However, how often our minds leave the present and where they tend to go is actually a bigger predictor of our happiness than the activities in which we are engaged. So it's not just how often are you present, but where does your mind go? And Killingsworth says that a wandering mind is an unhappy mind. So when I look at this, which one describes you? Your mind is full, that's usually us, or mindful. And notice that I can see the trees. I can see the sun. When I'm mindful, I really can't see anything in that picture where there's a car and there's a person and there's a door, and I can't make heads or tails. So if I'm feeling sad, or if I'm feeling anxious, or if I'm feeling happy, I can't discern between any of those when I'm in default mode. I just see them, all of them, all at once. So mindfulness, what do we ask you to do? Jon Kabat-Zinn is really the father of Western mindfulness. He was the first person to introduce this idea that goes back centuries. Mindfulness, the concept of it comes from Buddhist philosophies, although it's completely secular, there's no religious connotation. At this point, the concepts have been around, but Kabat-Zinn brought it to medicine and said, wait a minute, everybody. We have these diseases we can't always cure. And even if we can cure them, there are steps involved. And each of those steps take a toll on the human spirit. So how can we alleviate some of that? What did we do? Purposely paying attention in the present moment in a very particular way. And a critical thing I want to highlight here is non-judgmentally. A form of attention training. So I need to pay attention to what's going on right now, and we'll talk about how, and not judge. It doesn't mean that we're asking you to pretend like everything's okay, because that is not mindfulness. And when you're suffering with a chronic illness, with CTCL, everything's not going to be okay every day. But it is the idea that you're allowed to be present in your feelings and to look at them and not judge and not be mad at yourself, not feel guilty, not feel like you should be doing something else, that you should feel a different way, just acknowledging this is how you feel. So mindfulness is not. We live in a world, especially in Los Angeles, and I know it's kind of everywhere, where there are many trends, right? If you're on Facebook, if you're like me, every time I go into Facebook, there's something new. Try this therapy, try this relaxation, this type of yoga. Mindfulness is not a trend or a fad. It's really it's not a relaxation technique. So I'm not going to say, okay, if you practice mindfulness, you're going to be calm and cool as a cucumber. It's not about having a particular kind of experience. I won't share with you how mindfulness is for me and expect the same for you. It's not religiously affiliated, and it really, and I want to highlight this, is not about absence of thought. It's quite the opposite. It's being present and being aware and influencing what you're thinking about. It's not easy, but it is simple. And it's also not about doing things slowly. You know, if you've ever been to a doctor's office, which I'm assuming all of you have, you see that we have to work with a sense of urgency. Every day, I want to give each and every one of you that I interact with the same attention that you deserve. And if I were going very slowly, that would never happen. But I want to be present with a sense of urgency to make sure that I'm getting from you what you need me to know, and that I'm able to be present to give you what you need. So it's really, remarkable to be able to see that your thoughts are just thoughts and they're not your reality. If you think about that for a second, when you're dealing with chronic illness, when you're about to have that next PET scan, when you're about to start a new clinical trial, when you are going to go back to work, all of these things can be terrifying. And we live in this moment where those fears and the pressure of what we're anticipating becomes reality. And this simple statement is to help remind you that thoughts are exactly that. They aren't the reality. And so if we can shape how we think, then we can shape how we experience things and try to be more focused on what's happening now, step by step, as we go through things. So mindfulness training, you can do one of two things. You can go online. UCLA is one of my favorite resources. I might be a little biased because I went there, but there are formal practice options. In that formal practice, if you're in a class or a workshop, you'll be bringing attention to a chosen focus. So you'll be guided to focus on pain, focus on stress, focus on anger, whatever it may be, and then noticing when you're distracted, not judging, but noticing when you're distracted, and then trying to return back to that chosen focus. It could possibly be breathing, it could be a sound in the room, it could be the way the ground feels against your feet. And the hope is that you can keep returning to this chosen focus with a gentle, non-judgmental understanding and matter-of-factness. This is an observation. There's no feeling attached to it. I'm uncomfortable. I'm sitting on a hard floor. All right, those are the types of things you'll be looking at. But a lot of times the object chosen is breath, because we have it, because I carry my breath with me. I don't need a prop. I don't need to be in a yoga studio. It's my breath. In formal practice, the similarity is the same quality of attending. Can you attend to your own thoughts, your own focus? And it's directed to the mundane events, experiences of everyday life. So can you pay attention to what you are doing as you are doing it and being fully aware of it? Things that I have practiced with in some of the classes I've been in and then at home with eating is really stopping and eating something that you eat every day, a pretzel, a grape, and thinking about it. What does it taste like? What does it feel like? Things that we don't even pay attention to at all anymore. I've eaten a grape. I'm 40. How many grapes have I eaten in my life? right? But if I stop and pay attention, it's a new experience. Again, working, if I'm paying attention to what's going on, it's a new experience. We're going to talk really quickly about something called stop, and even walking. If you like to be outside, if you like to be inside walking around, focusing on the steps, each step, how it feels, what muscles you're using. In situations where you don't really have time, you walk in, you're in the doctor's office, and we're about to do a blood draw because we like to do that, right? And we're going to take more blood, and it's sprung on you, and you don't have time to sit in a corner for 5 minutes. You are starting to feel anxious, or you're starting to feel uncomfortable. You can use this. You can stop. S means stop what you're doing. T, take a breath. I know everyone's breathing, but we're not thinking about our breath all the time. So take a breath that you're thinking about and observe how you feel. When you observe how you feel, you can actually understand what you're feeling and try to work through it, and then go back and proceed with what you're doing. You'll be surprised. You use this little stop technique, and it slows down the automaticity, and it slows down the reactivity, and allows you to regain control over how you're feeling, what you're thinking. So this all sounds lovely. Mindfulness seems to make sense, but does it really have benefits? In the studies that are available, it does directly impact our development, our health, our healing, our wellness, and behavior. So there are 9 functions of the medial prefrontal cortex, and you can see it on this little picture of the brain, but this area is affected by mindfulness in a significant manner. It's involved with everything from body regulation, communication, emotional balance, being able to respond in a flexible manner, which is critical when you have a chronic illness that is going to change day to day. Insight, can you modulate the fear that you feel, intuition and morality? But most importantly, studies have shown that it's trainable. So at the end of the day, my hope for all of you is that you're as happy as you can be, and that as we work to find a cure for CTCL, which we will do, in the meantime, how do we help ensure that you have the best quality of life possible? And beside that, keeping your body as healthy as you can to deal with the types of treatments that you might need moving forward. Psychologically, we can give you a medication, we can recommend treatment, but none of it works unless you're in a place where you can accept it and utilize it. And one big thing to help with that is mindfulness intervention. First off, you have improved cognitive and attention skills. So you can listen to all of the choices and choose a response that makes sense to you instead of just reacting to a situation. I don't feel good. I want this fixed, so I'm going to pick this treatment, or I'm going to go here because I need it fixed now. If I practice mindfulness, perhaps I can take a step back, take a deep breath, look at all of the options, and choose a response that fits my situation best. I can self-regulate. As these new challenges and these new obstacles come up, I can learn how to use my breath or focus to get back to a place where I'm comfortable. It reduces stress, depression, and anxiety, which unfortunately come hand in hand a lot of times when life doesn't match what we thought it would be, which happens in chronic illness. It enhances the skills for interpersonal relationships. And I want to share this too, that this is not just for those of you who are going through CTCL experiences yourself, but also for the people you interact with, because each of you are going to experience a lot of strain at different times. And mindfulness allows for that interpersonal relationship skill set that can get you through this and allow you to have a fantastic support system or to be that support system. And it offers reprieve from stress. Physiologically, and this is important as you're going through treatment or just living day to day, decreased heart rate and blood pressure, you can sleep. Now I know with cutaneous T-cell lymphoma, one of the biggest complaints that I have from most of the people that I work with is a lack of sleep. And so I share with people, okay, we have medical interventions. Why not augment those with things that we can do ourselves that have no toxicities, including having better sleep through mindfulness? Change the perception of pain. One specific example that I learned in a class was when you're having pain somewhere, focus on that area of pain. It's counterintuitive, I know, but you want to focus on that area and then focus on something that doesn't hurt. Maybe it's the tip of your nose. One area that doesn't hurt, then focus back where it hurts and then back on the area that doesn't. The reason for that is if you try to ignore the pain, the brain is going to keep going there. It's like a chocolate cake sitting next to you when you're on a diet. You weren't thinking about chocolate cake, and if you were allowed to have chocolate cake, you might not even want it. But because it's there and you say you can't have it, you want nothing else but that chocolate cake, right? That's the same thing with pain. Your brain is going to be drawn to that stimulation. So follow it, but then bring it back to something that's not painful. Then bring it back and forth until that pain is mitigated. There's also improved immune function, and as I mentioned, some increased activity in that medial prefrontal cortex. I venture to guess that many people feel like they're no longer in control. When you have a disease that's on your skin that other people can see, you don't even have control over who knows that there's something going on. When I'm dealing with patients who have lymphoma on the insides of their body, they don't have to tell anybody. But if you have cutaneous T-cell lymphoma and there are skin lesions that are seen, that's taken away. The medications that we give when you come to see us and you're sitting in an infusion chair, the nurse is in charge of when the medications come and what they will be. Most of the experience can make or lead to you feeling very helpless, out of control, not able to influence what happens. So mindfulness can really help you to take back some of that control. You get to learn techniques that work for you, for your experience, and find what works and use them. You also have to be able to allow yourself to stumble, because they're simple techniques, but the same thing doesn't work for everybody, right? Cutaneous T-cell lymphoma, if I put 10 people in the room with the exact same diagnosis, the exact same stage, it will be different for each and every one of you. And so is this. So please be gentle with yourself, allow yourself to stumble. Think of self-care as a prescription that if I could write for you, I would, that allows for long-term emotional fortitude and self-healing. And at the end of the day, learning how to be in the moment and be okay with what's going on and really have influence over your quality of life. So here are some resources that I have provided that really have, free online courses, free meditations, guided imagery, mindfulness books. If you need any other resources, we can make sure to get them out to you, but they're everywhere. And my hope is this is a jumping off point for as many people as are interested. This is really,
Wow.
what I wanted to present. Susan, I don't know what you think, if you practice any mindfulness.
I do. And, I have to say, I feel way more relaxed right now, because while you were talking, I was concentrating on my breath and bringing my focus back to the program. And it's to me, it is, like you said, it is not difficult to learn, but hard to put into practice. And I think it takes practice for anything like this. And I know for me, going through this disease, one of the biggest challenges, but one of the biggest things that really helped me was finding those ways where I had control over things. So for me, exercising was a big thing. It helped give me a sense of control, something that I was doing for myself. What I was eating nutritionally, all of those things. But this I really could have used 20 years ago. Wasn't quite as prominent as it is today, and harder to find some resources. So I think it's really important for all of us, whether we're living with cutaneous lymphoma or living with someone who's living with cutaneous lymphoma, or or not, just every person. I think it gives you a whole different perspective on life and helps you to deal with those daily things that we all deal with as we go through life. So I'm going to open it up for questions. There we go. Oh, good. Somebody likes the resources. You're quite welcome. That's
Yeah,
great. And
we don't have any
okay,
questions
go ahead,
yet,
Mike.
Susan, but we do encourage anybody watching in the audience, if you do have any questions or comments, go ahead and type them in. We put up one of the comments. Somebody said how much they love chocolate cake. So I think you hit a sweet spot there, Erin. No pun intended.
Yeah, exactly. Yeah, I know this is a little different kind of a discussion or a conversation than, the hardcore clinical treatment things where people have very specific questions. I think sometimes this is a little bit different to wrap your head around, but a really important component and something that we can all do for ourselves. We don't need to travel to a physician's office or anything like that. So, I just encourage everybody to that your acronym with STOP is brilliant. And I will be using that often, especially when I'm driving in traffic. Even though I don't live in LA, Philadelphia traffic can be a challenge too.
Philadelphia is bad, yeah. And
yeah.
I think, perhaps for anybody listening, practical applications of what we were talking about, because it is kind of esoteric, right? It's this concept that you're going to breathe differently and think differently. It will not happen overnight. And instead of trying to teach people techniques in a big classroom, the individuals that I get to interact with when I'm about to do a skin biopsy, for instance, there's a lot of people out there, I'm sure, who have experienced this. You've probably had more skin biopsies than you'd like to count. And there can be anxiety that's associated with it, especially when it's in a painful area. So when I'm about to do a skin biopsy, especially when I'm injecting lidocaine, I'm actually guiding people through the way that they breathe. And so knowing that, focus on the breath, and if you're exhaling, it's a little more challenging to clench up everything and you feel less discomfort. I've had a lot of people tell me that their biopsies are somehow less painful. If people verbalize to me that they're very fretful about a treatment that's about to come up, or if there's a lot of angst between a loved one and a patient, and as we go through, it's because those feelings aren't really sorted out. And every time before you come in to see one of us, there's arguments, let's say, or every time before you come in to see the doctor, myself, our team, you don't sleep the night before. These are all cues to me, and whether or not the person I'm interacting with sees that this is a perfect time for mindfulness, I do try to help give some resources then. And the only way that I knew how to do it is I search for them myself. I have shared with many of the people that I interact with that I have severe diabetic neuropathy. So when I'm working with people who tell me about the nerve pain that comes along with a lot of these ulcerated lesions that you can get, I unfortunately really can understand. And I spent many, many years thinking about the things I had lost with the neuropathy. I was a dancer. I loved to be very active. And I got to the point where it was so painful to stand up that I was limiting my activity. And it caused a lot of sadness. And yes, I was able to find some medication that helped, 60% maybe, but I still had that 40% and that lack of sleep and looking at things that I had lost. And so I was drawn to learning about mindfulness through this for myself. And I can say with complete honesty, I've tried everything that I'm mentioning on, and outside of mindfulness, I've tried many things, yoga, focused meditation. I don't sit in a corner and say Om very well. My brain is going a lot. And this technique or this group of techniques with mindfulness has been the most effective. So I just want to put that out there, that if you're a little bit doubtful and you've tried other things and you're really not sure how this will help, I just tried to give you some practical applications within the realm of how I would interact with some of you. And see if you try them. See if it can help you get through an experience a little bit easier.
That's great. And someone was asking, which I think this could be appropriate. A lot of folks suffer fatigue, whether it's from, the side effects of the medications they're on, or sometimes it's just all of these things put together. It causes just exhaustion, right? And sometimes it's just plain old physical fatigue. So I would think this could be helpful. Do you have any experience or anybody that has used it to address fatigue?
Definitely, because I think I'm not going to claim that mindfulness is going to get rid of fatigue. I think with cutaneous T-cell lymphoma, outside of treatment, fatigue is a component. And then we give you medications that make you more fatigued. However, I think there's a component of fatigue that's exacerbated by stress. So when we minimize the stress, because stress has a physiologic impact on the body. So if the body is constantly in that fight or flight, that adrenaline, the epinephrine, all of that's running, it's taxing on the body and it adds to fatigue. So what I like people to think about is, again, even in percentages, if you're a numbers person, if you want something tangible, if we could reduce your fatigue by 30%, that's 30% more life you would have to enjoy, because you wouldn't be tired all the time. If you could use mindfulness to get rid of some of the pain, you may sleep better, which leads to less fatigue. And I'm really glad you brought it up, Susan, because, mentioning the neuropathy, I had a doctor who looked me in the eye and said, "You look really tired." I said, "Yeah, I'm tired." He said, "Are you sleeping?" I said, "Well, I guess." I said, "My husband says I wake up screaming in the middle of the night sometimes." And he said, "Because your neuropathy is so bad." And I had gotten so accustomed to it. And I don't know, Susan, maybe you can speak to this too. After so much time, we get numb to the pain in our minds, right? This is just my new life. I'm just tired.
Right.
I just hurt, and don't realize that if we attack that pain, attack that stress, attack some of the other things that are going on, our fatigue might be much better.
Yeah, and I think to your point, we forget what it feels like to be healthy or to feel better. You get very sucked into, to your point, you just think that that's the way you're fine, right? Oh, I'm fine, but you're really not. And you
Right.
forget what it's like to feel better. So
Yeah.
having the opportunity to just take things down a step or two. And I know for me, really paying attention to that flight or fight, keeping that adrenaline going all the time, and paying attention to coming off that treadmill purposefully can really make a difference. It makes a difference in sleep. It makes a difference in how I manage, a stress. Sometimes there are days where the littlest thing that shouldn't be a big deal just kind of pushes you over the edge. And that's usually when I say to myself, oh, yeah, time to take a minute, right? Because that shouldn't have tossed me over the edge that far.
And I think that's a huge point, Susan, is that you just brought up a concept of mindfulness. I don't know if you even realized it, but you're present, so you recognize your actions and how you feel, which then allows you to stop and use techniques that you have to improve how you're feeling. Right. And that's really one of the key points of mindfulness, is you didn't judge yourself and say, wow, I'm a bad person because I felt that way. You stopped, you recognize, this is how I act, this is what it feels like when things are out of control, or when my symptoms are taking over, or when I'm just not happy with where things are right now. Because you recognize it, you take a deep breath, you can then change it, right? You then have some influence on how it's going to be. And I think that we need to remind ourselves as human beings on a regular basis that we deserve to have a good quality of life. And that perhaps if we don't have expectations, right, if I'm not expecting to feel like I did before a diagnosis, and focus on what I feel like now and identify when I feel okay, that helps. And the permission to feel okay. You know, when you
Yeah.
have cutaneous T-cell lymphoma and you're suffering a lot, do you tell yourself it's okay to feel good today? It's okay to be with what you're doing right now and enjoy when you can. Because that's another thing that I see people, they just give up on experiencing joy. And that's the hope with mindfulness, is a reminder that joy is important.
Yeah, yeah, it's very, very important. And Mike, we had a comment from someone that I missed somewhere. Oh, there we go. So many patients have anticipatory worry about bad news or poor clinical results when they go back to their doctor for follow-up. What better coping mechanisms can you suggest to prepare for possible bad news? It's a good question.
And it's an excellent question. And we're conditioned, right? So when you're in default mode, your brain becomes conditioned. I go to the doctor, I have a scan, the news is bad because it's happened, right? That's a natural reaction. But going back to the point that thoughts are only thoughts, they're not reality, is critical. And learning how to A, acknowledge the fear, B, then have some mechanisms for mindfulness. Where am I now? Right now, I feel healthy. Right now, I'm being treated. Right now, in this moment, things are okay. And if things are different when I go to see the doctor, what techniques and tools will I have to deal with that? Sometimes just being empowered with knowledge of how to regulate yourself allows you to know, I'm going to get through this. That's one first step. And then the other exercises, like we talked about, Susan, for you, it was exercise. That is a form of mindfulness, right? How you ate. You thought about how you were going to eat. You prepared these things. And all of the things that you do to nourish your body, believe it or not, you have to balance those things out. So you have the fear. What things are you going to do to counterbalance that? So it's not fear, 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 taking care of myself, getting it more to here. But it is also acknowledging that fear because it's real.
Yeah, and I think that's something that we, at least I know for myself, I'll just speak for myself, I've been conditioned and brought up to sort of shove the fear back in the corner and ignore it. But as you've said, it never really goes away. It just keeps spinning in your head and then tells you really scary things, and it kind of takes over. So if we can use these kinds of methods to, when we recognize we're kind of gone down that rabbit hole for no real reason, right? To stop, take a breath, kind of recognize that that's okay to feel that way. It's okay to have the fear. Everybody can, fear is okay. It's just then how do you manage yourself in light of that, right? And give yourself an opportunity to look at things a little differently, and how you approach it. So great questions. I love our audience. They're always so insightful and thoughtful, and they pay attention, which is really good. Really good.
Well, Susan and Erin, I think those are all, I'm sorry, I think those are all the questions that we had from the audience. I did put back up the resources page that Erin had created, so we're sharing that in case anybody wants to pause the video, because it will be available on demand on Facebook. It'll stay up there so you can watch the video afterwards and pause it. You don't need to jot down these web addresses right now, and you can go back and refer to them at your convenience. I just want to mention that.
Yeah, that's great. Thanks, Mike. And again, because this is all recorded, you can all go back and watch and do the stop exercise at any point in time too, at your leisure, and in the comfort of your own home and in your own time. So thank you, Erin. At least for me, this was huge. Especially while August to me always seems like the month in the summer where things slow down the most. And I personally have a little bit, not usually a lot, but a little bit of time to take a breath and regroup before kind of the craziness of September hits. And I guess, go back to school and things seem to get busier. So I am taking your techniques with me for at least the next week before, we hit the other side of Labor Day, and to practice. Just take an opportunity to practice and keep myself grounded and focused and hopefully healthier. So that's all good. So thank you so much for joining us tonight. We really appreciate it. And, tell everybody at the City of Hope that we said hello. We love your crew there, and you guys do great work, and we really appreciate everything that you do for patients every day, and bring your heart and soul to the work that you do, and it really does make a difference. So thank you for joining us and for everything that you do, and we'll let you go back to your family and enjoy the rest of your evening and the rest of your summer, hopefully, with a little time for a little R&R.
Thank you, Susan, and thank you everybody who make this possible. It's the patients, the people I get to interact with every day that have really touched me, and I hope that this helps. And thank you again, the Cutaneous Lymphoma Foundation, such a resource. And anything else we can do in the future, the team at City of Hope is there.
Yep, absolutely. Absolutely. Well, thanks, Erin, and have a great night. So before we let you go, just a couple of follow-up announcements. I want to let everybody know next month we will have Dr. Steve Horwitz from Memorial Sloan Kettering as our guest. So stay tuned for that, and we'll send out all the notifications and the dates. Go ahead, Mike.
Yeah, Susan, that'll be on Tuesday, September the 18th at 8 p.m. Eastern. So mark your calendar now, Tuesday, September the 18th at 8 p.m. Eastern. And Dr. Horowitz will be talking about brentuximab. So he'll be focusing on brentuximab vedotin.
Yes. And the trade name for some of you that may not know what that is Acedris. So, they have the drug name and then the trade name once it becomes available. So we're excited to have Dr. Horowitz with us. So bring your questions and everything you want to know about brentuximab vedotin or Acedris. And then I also want to invite everybody, as you might know, this is the 20th year of the Cutaneous Lymphoma Foundation. We are celebrating, and we are kicking off September Blood Cancer Month and celebrating World Lymphoma Awareness Day on September 14th with a new program that we invite you to join us on our 2020, which is celebrating our 20 years, and we're asking everyone to support us by donating $20 and asking 20 friends to donate $20. And in that way, you all can participate, hopefully, with a small investment and support all of our programs and the things we get to do, like this Facebook Live program that actually, unfortunately, nothing is free, and we have to find ways to pay for it. And as a nonprofit organization, part of what we do is having to raise money. So we're really excited about this really easy way that you all can help keep us going for the next 20 years and give us the opportunity to bring new and innovative programs and ways of sharing information so you can be empowered. And I know Mike's been putting up some additional information. We'll have some announcements, so watch your emails, and you can go out to the website and you can set up your own web page. It's made to be effortless and easy. And I'm going to be participating. It's a really big time for me. It's been 20 years this year since I finished up my 3 months of radiation treatment and kind of came out the other side without needing a stem cell transplant. So this is a huge 20-year milestone as well. And my birthday happens to be September 20th. So it all kind of comes together, 2020. So join us, please. And I hope to see you all next month when we have Dr. Horowitz with us. And in the meantime, practice your mindfulness, and we wish you all the best of health and wellness. And if you need anything, we're always here to provide resources or help you find the resources that you need anytime. So with that, I think we'll sign off and wish everybody a great rest of your summer here in the Northern Hemisphere. And for those of us that celebrate our final holiday of the year, Labor Day weekend, and in another week. I hope you all have a great time and enjoy some time with family and friends. So until next month, we're signing off. Have a great night, and we'll see y'all soon. Take care. Bye.